Good afternoon, everyone. We want to welcome you for Health Vision Midwest and the Vaccine Messaging Task Force. We also want to be sure to thank our quiet sponsors of Mr. and Mrs. Mark Music for this event. We're very thankful for that. Today we're going to talk about the vaccine. So I want to give you a little bit of background. Health Vision Midwest is a faith-based nonprofit organization that works to advocate for the underserved, develop and facilitate partnerships, and address systemic community health disparities. We have an office in East St. Louis, and our corporate office is in Hammond, Indiana. In March, Health Visions reached out to partnering agencies that showed interest in breaking down access barriers for underserved groups to receive the COVID-19 vaccination. That's when the Vaccine Messaging Task Force came together. This task force wanted to find out ways to get people such as African Americans, Latinos, and the Burmese residents who live on the southeast side of Fort Wayne greater access to the vaccines if they chose to be vaccinated. More than 20 organizations and local agencies had attended our virtual task force meetings over the past 3 months. Many engaged in the vaccine registration week. In mid-April, where partnering agencies and volunteers registered more than 200 people for vaccinations. Many were non-speaking residents. The task force also kept local leaders aware of new developments and opportunities concerning vaccinations on the southeast side of Fort Wayne. It also inspired various agencies to host or sponsor their own pop-up clinics or to work in conjunction with local farmers, retailers, and government agencies to offer walk-in vaccinations. Of course, there is still much work to be done. The question is, where do we go from here? The percentage of vaccinations in the southeast zip codes 46803, 46806, and 16, they're rising, but we still lag behind many other zip codes in the area of Allen County. While we don't want to condemn people who chose not to be vaccinated for various reasons, we do want to ensure that everyone has access to make the right choice for them. That means breaking down barriers when it comes to language, access to internet, getting information that is not misgiving, and in some cases, giving transportation. Of course, one of the largest opportunities for walk-on clinics is here at the Macmillan Center. This is going on through the week until Saturday. This is a mobile site sponsored by the Indiana Department of Health. We are excited to have with us today Shane Hatchet, Chief of Staff from the Indiana Department of Health, on our panel today. You, the audience, will have a chance to ask questions. If you have a question to ask, please raise your hand and one of our staff members will be able to give you an index card to write down your question, and we'll answer the question as we read it so you'll get your answers. Right now, we're going to begin our panel as Mr. Hatchet tells you a little bit about himself, and the panelists will briefly introduce themselves and what agencies they represent as well. So if you would please give us a little applause for Mr. Hatchet.
Well, thank you all for hosting this and for frankly being here and being interested in this work. We had a media availability earlier this morning, and we talked a little bit about really reflecting on the last 15 months or so and what that's been like. And it honestly is really nice to be in a room with people and being able to have conversations about getting out of the pandemic and how do we do that. And the short answer is vaccinations. We know that that's really what is causing the lower hospitalization rate that we're seeing. We know that it is helping cut down on transmission and spread of the disease. And more importantly, we know that that is why there are fewer deaths today than there were even just a short 6 months ago. When we look at what people who are being hospitalized presently, we know that over 99% of those individuals were not fully immunized. And so what that tells us is that the vaccine is not only effective at helping cut down transmission, but it also is effective at keeping people out of the hospital and keeping them alive. And when we are looking at communities such as this, that was disproportionately impacted by the spread of COVID, and frankly some of the poorer outcomes of the disease, we know that this vaccine is a way to help keep Black and brown Hoosiers safe. So where we stand today is there are over 2.4 million people in Indiana who have been vaccinated, and our numbers within the minority communities are on the rise. So we're seeing more and more African American and Latino Hoosiers getting vaccinated. And interestingly, the data show that our vaccination rates among Asian Hoosiers tends to actually be closer to the state average where we would expect that to be. But to Peggy's point, we still have quite a bit of work to do in terms of getting those numbers to where that disparity is greatly reduced and the community, within itself and the broader community is safe. Some of the things that we're doing to try and promote that awareness is obviously have sites like this that are out in the community where they're most accessible to the people who need them. I've been over there a few times today, and as I look at the individuals who are lined up in registration and the observation area, I'm really heartened to see that we are hitting exactly the right kind of demographics that we need to be in order to be successful at decreasing that disparity. Something else that we've done that we know has great impact is pushing out emergency alerts over people's telephones when we have these types of clinics. We know that not everyone has access to news feeds or other media outlets, and so putting it on something like this in front of people is a really great way of really driving home the impact, driving home the availability and accessibility of these vaccines. And actually, as I was walking over from the clinic here, someone stopped me in the road and said, "I just got this alert, and is this where I need to be?" And I said, "You're exactly at the right place, just keep going forward." So it does work, we then had a conversation about, is the vaccine safe and effective? And so, I shared with her and her partner the data around that, and she shared her concerns about side effects. And it struck me in that moment that this is really kind of the last mile, so to speak, of vaccination effort that we have before us. This is going to be the great mandate to public health, is meeting people in those moments and having these conversations in frankly more intimate ways than broad-based news releases or PSAs. It's going to be having people who look and sound like the folks we need to target share this message with them so that they have that degree of trust and credibility that some of us don't have within those communities. So in terms of kind of where we go from here, we have really been focusing on now the 12 to 17-year-old age group. They recently became eligible for vaccines earlier this month. And I think that's really important because it helps those individuals get back to a sense of normalcy. They no longer have to quarantine once they're fully immunized, and if they subsequently become exposed. So they're able to continue those important activities to them that they've missed out on, and those important rites of passage that they've been denied over the last 15 months that we know, frankly, will persist in terms of stressors and different types of trauma into the future. That we have to talk about how next do we address that as a community and a society. But at least vaccines offer us a way to start containing and mitigating that moving forward. We also have a number of resources available to individuals, either through our 211 hotline. They have translators available who can help people register and book. They also have individuals who can answer questions about the vaccine, not unlike what happened to me earlier today. We can get people the correct information, the right information, so that they can make an informed choice. Again, to Peggy's point, we don't want to pass judgment on people who choose to not be vaccinated, although we would greatly recommend that everyone be vaccinated unless their medical provider says that that's not the right choice for them. But we do know that the best way out of this is achieving herd immunity so that we can sit much like this dais up here without our masks and feel safe and protected and know that the likelihood of transmitting the disease or even getting the disease is extremely low. And even yet, risk of death and hospitalization is virtually none. The final thing that I wanted to kind of hit on here is we have in our midst this interesting point where the proliferation of social media is this double-edged sword. It's a great way to get information out, but it's also a great way to get bad information out or misinformation out. And so we have seen, these, I'll just call them myths or not even urban legends, but the idea that the vaccine contains a microchip or that it alters your DNA or that it will prevent you from being able to start a family in the future. None of those things are true, could not be further from the truth. I think, I can take a liberty of speaking for everyone up here to say that the worst thing that happened from the vaccine to any of us is probably some aches and chills afterwards that are easily remedied with hydration and Tylenol. So, for those of you who are working with individuals who are on the fence or are concerned about that, I think we have to address those things head on and really start to have those conversations and not just outright dismiss people who have hesitancy, but talk to them about why and understand more about that and drown out some of that rhetoric that is out there today so that we can really focus on those individuals who really just need that extra push to make the choice of getting vaccinated. I'll leave it there.
All right, thank you. I'm going to introduce the rest of the panel and social agencies because I have some questions for you.
Good afternoon. My name is Raquel Kline, and I'm the director for Language Services Network. We're a local program that provides interpretation and translation services for our limited English speaker population that we have living here in Allen County. And we have been working with the Vaccine Task Force in the capacity of reaching out those populations that language becomes a barrier to accessing vaccines. And also the translation of information so they have it in their own language and they know what they're reading and what they need to do in order to get vaccinated. Thank you for inviting me.
Thank you.
My name is Larry Gist. I'm the president of the NAACP here in Fort Wayne, and I'm also the operation manager for the MAK organization.
Good afternoon, everybody. My name is Nyein Chan. I'm working with Catholic Charities Refugee Resettlement and Immigration Service Program.
All right, Raquel, each of you will add in a moment. Tell me what your organization is doing as far as the vaccination is concerned.
As I mentioned previously, we have been working with translating information because we have a large population that speak different languages here in Fort Wayne. For those of you that don't know much, we have over 102 different languages spoken here in Fort Wayne, and that information comes from East Allen County Schools and Fort Wayne Community Schools. But the prevalent languages are Spanish, Burmese, Arabic, French, Bosnian, Vietnamese, and Korean. So when the pandemic took place, not a lot of information was translated, so we took upon ourselves with the responsibility to inform our community so they knew exactly what to do, follow the protocols and guidelines as far as being quarantined, and now we're helping with registering people and making sure that if people have questions, they can connect with us so we can help them with registration, or if they need to get transportation and those sort of things, and language is a barrier, we can provide the services so they can have access to the vaccine.
Okay, thank you.
Our organization, first we started out giving the COVID testing. We set up testing early in the year so people can come out and see if they actually had the COVID testing. Then we got involved with Health Vision and we started the registration, and now we're working with different organizations and providing the vaccines at different locations.
Catholic Charities started since last summer. It's about early May. We reach out to especially to the refugee community living in the southeast side, living in the north side of the town. We are distributing the PPE item, also the translated the COVID-19 information to the population. The following that, so we keep distributing the PPE item as much as possible. All the education we translated into the Burmese, especially, and we have them for the COVID-19 testing. Now, the last month, when the vaccine are available, so we started reaching out again with using our mobile unit to the where they are living, especially to the southeast side quadrant area. So last month, we have registration, translation for the vaccination for a little bit over 200 people of the Burmese population. So now we keep doing that as much as possible. And from now on, it have a lot of our work for the walk-in clinic. So no longer need a registration. Sometimes registration process take long, especially for the limited language speaking or no English speaking population. Now, almost everywhere in the Fort Wayne walk-in clinics are very helpful. We only can provide the transportation and interpretation at the clinic. Now we're looking forward to work in collaboration with the mobile clinics for the population where they do live. So that will help us a lot, and we are very excited about that also.
All right, thank you. Right now, I'm going to open it up to the audience. Are there any questions for any of the panelists up here? Does anyone have any questions? No one? Okay. We have some index cards that that's going to be given to you for your question. Anybody else want any index cards to write down questions? Hear about all this talent up here, all this intelligence up here, all this knowledge up here. Maybe I should do the Jeopardy song.
What are the methods of communication you're using to get the information out to the minority communities? Do they utilize churches, or how do they do that?
Okay, let's start with you, Mr. Best.
Well, yes, social media is one main effect, and also we have engaged with many of the pastors, especially on the southeast side, to put it out to their congregation.
Okay, how about you, Raquel?
We have partnered with so many different organizations in regards of sharing information, and we have the local newspaper that is in Spanish and Mexicano, so we have hosted what we call the forums, where we invite Dr. Suter to give updates on what's happening, and we have an interpreter that that interprets that information, and also articles that we publish in social media and radio station.
Okay, Nyein Chan?
Similar to the media outlets we use it, actually, so that our staff member reach out to our client, we call them, also we translate that to the flyer, working with the local organization. That's how we're going to be reaching out to the population.
Thank you. You have questions? Thank you. One of the questions is, how do I stop individuals from stopping others from getting the shot? Who wants to take a stab at that?
See?
How do I stop individuals from stopping others from getting the shot?
So can you take it? Oh, go ahead.
Can I? For me, is we every time, so we just encourage the other people who haven't worry about getting the shot. So we are talking about the good thing about the fully vaccinated. So the advantage or the we are no longer need to wear the mask, and then so that we are started talking about good thing about getting the vaccinated and encourage other people to get a shot.
I'm starting to use, I'm gonna call him a poster person, a person that had refused to get the shot at once upon a time, but then they contracted COVID, and they wish they had got the shot. So I'm using people like that to express themselves to others the important need of getting the shot.
Okay.
In my case, I have shared my personal experience in getting the vaccine and making sure that my mom is old and she has a lot of health problems, so I use that as an example that I vaccinated myself so she could be safe at home. Right now, thank God she got the vaccine, but you have to do it for yourself and for those that are loved ones that you care about and your community.
Take a stab at it, Sean.
So adding on to that, I appreciate the conversation around service to others and doing this as part of a civic duty or your duty to your community, realizing that not everyone is able to get vaccinated right now. So, newborns through age 12 are unable to be vaccinated. So we need to protect those individuals in particular, even though they tend to do better if they get the illness. That doesn't mean that there aren't complications or other factors related to that might be long-lasting health outcomes. So that's one of the ways that we tend to talk about it at the Department of Health. And to note that if you don't get vaccinated, you're one more potential point of infection that could create a variant that takes hold in the United States. And that's what we've seen in other countries, is when infection runs rampant, the virus will mutate. And so our best chance of not having to go back to any sort of hunker down Hoosier stay-at-home order or persistent mask wearing is to get vaccinated so that we snuff this out once and for all.
Next question. I'm seeing challenges with resistance from the millennial population. What do you say to that population? Who wants to take a stab at that one? I think you're on my limit here, so.
I've been called out. So I think it's the same conversation that I just talked about with a bit of a different spin. The millennials tend to think of themselves as the invincibles who don't need health insurance, who don't have to worry about what happens if they get the vaccine, and they're kind of willing to take the chance. And I recognize that I'm generalizing in broad terms and that the conversation is really much more nuanced depending on, other factors with that individual. But I think you have to, again, make it about something bigger than just doing this for yourself. It's protecting your grandparents, it's protecting a younger sibling or your parents. And I think that message, at least for me and my friends, has resonated really well when we've had those conversations, as opposed to, do it so you don't get sick.
Okay, thank you. Have there been any successful strategies for getting more Black people vaccinated? That seems to be a challenge locally, across the state, and nationally. Mr. Guest.
Well, the information has been put out, and the importance of getting the vaccine in the minority community. The information has been put out that, look next door, look at your neighbor, look at your family members, and look at those that have already been exposed to COVID or even died from COVID. And to let them know that they need to have the shot, and the importance of even minorities like that social gather. So they want to continue to do that, they need to get the shot. So the information is being put out more, but the results is still slow.
Thank you. This is to anyone. Why do you think people are hesitant or afraid of the vaccine? What could be some of the reasons that they might be hesitant or afraid?
Hesitant is the fear factor, just like what he spoke earlier. It's a way that the government is trying to track you. It's a way that another way of giving you the disease. The fear factor that happened with Tuskegee, the vaccination back then. It's a lot of fear factors. Now it's a fear factor that we just got informed not too long ago that if you get the disease, you're going to spread it. If you get the shot, you're going to spread it to the next person. So it's a lot of false information that's being exposed that we need to get corrected. Like the other one is it's the way that the government is going to track you. If you own a cell phone, the government don't need to track you because he already tracking you. So the exposure is there. So he don't need to put a tracking device in you because you're already being tracked.
Thank you. Raquel, what about your population?
In the Latino community, not everyone, of course, there's a lot of barriers, obviously language being one, but also if you are undocumented, people have had a lot of issues in regards to that because you are asked a lot of questions when you go to the sites. So people are concerned that that information is going to be turned into the authorities. So that's why a lot of people are afraid of looking for getting vaccinated. Hopefully a lot of information is out now. And we have been helping to spread the good information, saying that the vaccines are free, that information will not be shared with any authorities. And if that was the case, will never be allowed to be in any of the premises, because that's not what they should be doing anyways. And also there's a lot of misinformation, people reading information that is not factual in Facebook, or people are, they create these groups where they share a lot of information that is not accurate. So that has been one of the challenges.
Thank you. How about the Burmese population?
Through our experience with the outreach, the activities, we heard from the people sometimes, no, I'm not ready for take the vaccination. We ask them why this is free and then this is very good for everybody, the community. We realize that some people in the community, so they're not quite believe in the preventative health issue, prevention game. So I'm very healthy, I never get control with the virus. Why do I need to get the vaccination? So that is their response to that. Another experience, we learned that all the misinformation and the floating around in the community, they just wait and see what is the side effect of the people fully vaccinated. Now we are seeing that more and more people, they are willing to be vaccinated. That is it. So one joke thing, so because I reached out to the staff member and the community people, so when the church, Baptist church, they said, so, oh no, we're not ready, so we can do that later. So, but I don't know how to get the information someone said, oh, if you not taking right now, it's free vaccination. But if you take later, you have to pay. Then they almost everybody immediately trying to get the vaccination. It's just a joke. Yeah.
Well, that's a good one. I know that you have been boots on the ground, so what have you been hearing and experiencing people say when it comes to the vaccination? There's so many things that people are feeling and what they're going through. What are you saying?
We have talked to a lot of people in different locations. So the most recent one was at the Mexican consulate that was here at the Allen County Public Library, and there were tons of people there, probably like 1,000 people every day. And most people that we talked to, just sharing information, they were saying that they didn't want to get vaccinated because they were going to have infertility issues, particularly the female ladies. That's what they were saying, infertility issues. Some other things were like, well, if I get it now, then I will have to get it again and again. So it's a vaccine that I will always continue to get, which is, well, probably that's going to be the case, but that shouldn't stop you from getting it. And I think that's fear, people fearing that they're going to die if they get the virus, because they do think that it contains a live virus that is probably going to give you the disease.
And Chen, you talked about this morning in your talk. What are they saying? Because you talked about this morning.
Yeah, so I did specifically hit on the fact that, as we've talked already here, that it does not contain a microchip. It does not alter your DNA, and it does not impact your ability to start a family in the future. Other things that we're hearing and seeing is, it came to market too quickly, so how do we know it's safe? And, for that, what we do is have a conversation about how these were actually some of the largest clinical trials ever in the history of medicine. We're talking tens of thousands of people going through these phase 3 trials with all 3 vaccines. And Johnson & Johnson actually did global trialing. So, they really had a great representative sample of humanity in what they were doing with their testing of the efficacy of the vaccine. So we have really fantastic data that show that the vaccines are effective because we've been able to achieve in a matter of months what normally would take years to get that kind of volume of people enrolled in these trials. And that's just by sheer force of the fact that we were all in a pandemic and we wanted to get out of there as quickly as possible. And so we had a lot of, I think, altruistic volunteers who said, I'm happy to step up and be that person to test this out. And so that's how we know that these are so effective. And, we've continued to see that. And one more thing before I go to that part is the other pieces, they did a lot of the regulatory approvals in parallel with manufacturing. And so it wasn't that they just immediately rolled these vaccines off the assembly line and put them into people's arms. It was developing the vaccines and approving them through the regulatory process at the same time, whereas normally there would have been a lot more effort around getting research and recruitment dollars ahead of time, whereas the federal government made significant investments in that on the outset, which really shortened a lot of the runway that pharmaceutical companies needed in order to get this ramped up quickly. And so now that we are getting the shots in arms, and we've given over, I think, 150 million vaccinations in the country at this point, and we have CDC tracking adverse reactions across the nation, we know that these are some of the safest vaccines that there are out there, and that when we look at issues or conditions that occur, it doesn't pop up based on race, nationality, ethnicity, barring just a few things that have popped up in small numbers. They're really some of the safest we have out there.
Thank you. I have a question for you, Mr. Hatchet. There are people that are fully vaccinated, and they still contract COVID-19. What do you have to say about that?
So we call that a breakthrough case, and they do happen. We have a dashboard on our website that tracks the number of known breakthrough cases. And we do that because we want to know what happened and try to understand both from a clinical and an epidemiological perspective, what was that event, and maybe if there were some indications there that kind of contributed to that. What we often find is that for the 1,300 or so people in Indiana who have had a breakthrough case, is that they are oftentimes older individuals. They sometimes have medical conditions that maybe it compromise their immune system, or maybe they didn't have the kind of immune reaction that was needed to give them the level of protection from the virus. And the third thing is sometimes vaccines just don't work. And I know I'm sitting on a panel telling you, go get vaccinated, it's our ticket out. But what we need to know is, or be reminded of, is that this isn't a surefire ticket to never getting COVID, but it will 9 times out of 10 keep you out of the hospital and keep you off a ventilator. And that's what's important, is making sure that we reduce the severity of this illness such that if you do contract COVID, you're able to stay at home and take care of yourself and take care of your family and not be worried about whether your ambulance ride to your hospital is going to be the last time you see your family.
All right, thank you. There's been talk on the news around the country, talked about booster shots in the coming months. So can you speak on that?
I sure can. So Raquel's note is a little timely. Pfizer has, in particular, been doing a lot of research around booster shots. We have this with the flu shot, where annually we're kind of looking at what's the dominant strain and making sure that the vaccine is kind of aligned to that. And so in some ways, I would expect that the COVID vaccine is here to stay, at least for the foreseeable future. And as we continue to learn more and more about these vaccines and how long the antibodies last and what it takes in order to have that sustained immune response that's necessary to keep you safe, we're going to continue to, have evolving science around this. And I think booster shots are definitely that next step in this, that we may see in the fall a lot more direct, open conversations about this with respect to, those individuals who got those, for example, healthcare workers who got vaccinated last December. May be time for them to have a booster in order to make sure that they have that sustained immunity. It's not uncommon to have multi-dose series for vaccines. For example, most of the hepatitis series are multi-dose. Kids have to get multiple vaccines growing up, and then sometimes even as adults we have to get boosters for tetanus, Tdap, and other things. So I think this is just one of those things where, because of the prevalence of it, we'll continue to see evolving data and recommendations on that. I know this wasn't a question, but I wanted to plug it, that this fall we do expect Pfizer to be authorized for 2 to 12-year-olds. And I did see today a news release that Moderna had some really good data in 12 to 17-year-olds. So yet another example of evolving science around this, and that we'll continue to see a lot of activity in the pharmaceutical space on this. So another option for the adolescent population potentially coming down the pipeline. And then in time for, we hope, the school year, getting the younger kiddos vaccinated as well, so that they can continue doing the extracurriculars that they love, and again, those rites of passage that are important to all of them as we continue to keep everyone safe.
Thank you. I have a question. Will the text alert go out again?
I am not sure. Typically, we've tried to only do those once, but since we're going to be here all week, we may do another one around Thursday, depending on the volume of activity here. Unfortunately, we get a lot of flack when we push those out. People believe it's not an appropriate use of the emergency response system, but I will note that FEMA has authorized this. And actually was their suggestion at a couple different sites to drum up activity. So we do see good results when we use them, but we try to be judicious so that we're not constantly blowing up people's phones and reducing the effectiveness of those alerts.
I want to give each of the panelists a chance to comment on where do we as a community, where do we go from here? So I want to start with Raquel. From community perspective, where do we go from here?
Personally, I believe that we should continue to work together. I think the collaborations throughout different agencies and with the community at large works, and not keeping the information in silos, making sure that everybody shares information, and if you need something, it is a translation or interpreters to help people to get the vaccines, continue to work together, reach out and ask for collaboration, because I think it's important that we as a community work together, making sure that we eradicate, we will not eradicate, but make sure that everybody gets vaccinated and we can see the light at the end of the tunnel. So collaboration, I think, is very crucial.
Okay.
We still need to keep the community engaged, still letting the people know the importance of getting this vaccine, keeping the message alive. Let them know that it's not over with. It's still there. You're still exposed, and even your family members are still exposed, especially the older generation. So we just need to keep the message going and let people know that they need to get the vaccine and how important it is.
What happened right now is we are very excited about that. So it also we are increased the level of collaboration. I second to the record. So this is great. Now that what the vaccine task force, we should increase the availability of that, getting the vaccinated. For instance, so maybe we could work in collaboration with the local employer, so we could that vaccine available at where they work. So the interpretation, so that can be getting more and more people getting the vaccinated. So just like I started, so we are now is very good information for the walk-in clinic. So if we could more can do that mobile clinic available at where they live apartments. So that I have a feeling about that. So we more and more people engaging with to be vaccinated.
And from a state perspective, what do you think residents can do here? How can they play a role in this process?
So I think, you know, both where we go from here and how people can help is you're looking at it. It's becoming ambassadors of information, and it's kind of like when you see something, say something. When you see people sharing information that's false or incorrect, you know, making sure that you provide information that is, and linking them to materials that are peer-reviewed or issued by the CDC, so that they can make informed choices off of accurate information. I also think that it means for us as a state agency, continuing to reach into communities and empower community organizations to do the work. I don't think it is ever as effective when we come in and try to do boots on the ground outreach. I think it's usually met with distrust, and perhaps rightfully so. And so what we need to do is continue partnering with organizations like this across the state, such that the people delivering the message look and sound like the people who need to hear the message. And so I'm actually really proud to be here with my team, Antoinette and DeMarcus from our Office of Minority Health and Wellness, who will be spearheading a couple different initiatives on that front. ranging from different community grants to and getting some community health workers on the street at different organizations. And I think that's how we're going to address this last mile of vaccine hesitancy and getting folks to be vaccinated.
Okay, I have one last question. What is the most surprising reason that any of you have heard from a person who did not want to receive the COVID-19 vaccination? Something that's surprised you. Has anyone heard anything?
When we was doing the registration, this is just surprised me. A young man came in and said he's not getting the vaccine because my wife just died from COVID. And that was surprising to me.
Huh.
Seriously.
Okay. All right. No others?
It's similar to that. So when we have been done registration at the Auto Watch apartment, so the father brought 2 children for the registration. I asked, how about you? Why you are having your children registration? So he said that's a school requirement. So school said they have to get the vaccinated. So how about you? No, I'm not. So God, I've never been, just like I said, I've never been controlled with the virus, and I'm very healthy. So I don't need a vaccine to be vaccinated. So that kind of that surprised me, because he want the children to be vaccinated, but not for me. So a little bit of we had to be increase the education process of the vaccination. That's how I take that. Yeah.
All right. I want to, any last minute comments from anybody? Because this is very serious. There are still people thinking that this is some type of hoax. How they're thinking that, I don't know, because a lot of people have died from it. Not just in Indiana, this is worldwide. So I don't know why they could still think such things, but we just need to be doing our best. Again, we are not condemning anyone who does not want to take the vaccine, but it's an encouragement to take it. I don't know what else to say on that one. To each his own. You can't make people do things. I want to remind you that we have given you some surveys to fill out for us. So there is a single survey that we gave you. So if you would be kind enough to fill that survey out and give it to one of our staff members in the back, we would appreciate it. She's going to be giving you this, so please, we need this. We ask that you please fill it out. We want to make sure that we thank you so much for attending this event. And we thank our special guest, Mr. Shane Hatchet, from the Chief of Staff from the Department of Health. And we do have more food, so we just ask that you to go and enjoy yourselves, get more food. And we just want to thank you so much for coming. And hopefully something has been said that you can go and share with others, so they may want to get vaccinated. And remember, again, Macmillan Park Center is doing the vaccinations all week long. So there's no excuse for anybody if they want to go to the walk-in clinic, come get a shot, or come and get information. So thank you very, very much.